So I got a patient here today that's been dealing with chronic wrist injury. He's been having pain kind of through his forearm down into his wrist. He gets some numbness, tingling. So today I'm going to kind of walk you through an osteopathic assessment and treatment, kind of give you a different perspective on how I look at the body and how everything works from an osteopathic mindset, okay? From a chronic perspective, because he's been having pain for so long with this wrist and it's reoccurring, we're going to kind of piece together where things might be coming from. Osteopathic treatment, a lot of the times someone may come in with a wrist injury and at first I might not be working in that area, and it's just because we're trying to create motion and movement in all the joints that could be related to that area that's working too hard or under stress or pain. So from the brachial plexus, which is a bundle of nerves in the neck, there's three major nerves that come out of the neck: the median nerve, the ulnar nerve, and the radial nerve, and they all at some point come down the shoulder, cross underneath, and will come all the way past the wrist. And so we're kind of looking at all the points down to the wrist that can be interfering with those nerves. A big one that I kind of seem to come across is how the radius and ulna kind of glide on each other and allow for supination and pronation here can factor into how the wrist is functioning. So we got the radial head here that attaches into this section, and making sure that this joint is moving can affect how the wrist functions. So we got a lot of different bones, joints, and so specifically when I'm assessing and looking for kind of where restrictions are, I find that in this intercarpal kind of area, so this is a set of joints in between these carpal bones, we get predominantly a lot more movement. But as we get higher up in the wrist, at the radius and ulna between the joints there at the carpals, it gets a lot stiffer here. So we're just trying to assess and work through where the tissue restriction is.